Also really important to try and understand what's happening with them, whether or not they're short and tight or they're lengthened and loaded, because a lot of the time your athlete's going to come and say my hamstrings are tight, and you're like, well, are they actually tight? Are they short or tight, or are they lengthened and loaded? So inevitably, if they're lengthened and loaded, their straight leg raise should be fairly good, and obviously on both sides. So that being the case, a lot of the time that's going to be where the quadriceps are actually really probably short and tight, drags them into that position. But if they are short and tight and we want to do some lengthening techniques, I think this technique obviously is probably my favourite in terms of trying to help increase that range of movement, especially from the soft tissue point of view. So the first thing we'll do is just a bit of a straight leg raise. Now what's really important when we do a straight leg raise is make sure that you check the back and there's not too much hyperlordosis, because you're not really going to get a true indication of what's happening with the hamstrings. So make sure that you rule that out. And as you take the leg up into hamstring range of movement, what you want to do is see what's happening at the foot as well. So whether or not the foot starts to turn out at the end of the range, because sometimes that can indicate that we've got some tightness on the outside there as well. But for the most part, whereabouts do they feel the restriction as they go through this range of movement? So sometimes it'll obviously be down towards the back of the knee, or it might be mid-belly, or it might even be up at the hamstring attachments, okay? So regardless of where they feel it, this technique is obviously going to try and approach where they feel the restriction all the way through the muscle. So quite simply, bend the knee a little bit here, okay? We come underneath. We want to explore as much hip flexion as we can. So you just relax there, Tess, go back as far as you can. That's terrific, okay. So as much hip flexion as we can. Make sure that there's no pinching through the front of the hip. There's none there, is there?
No.
Okay. And obviously applying a little bit of pre-max. Along the length of the muscle. Okay, once again we come in with a broad elbow and just relax there, Tess. That's good. Okay. So this is once again a sort of a passive release technique. So we're looking at trying to increase that range of movement towards the end of the range of movement. So that differs from every athlete. Tess has got fairly good range of movement, 90 degrees, which is good, Tess. And Tess being obviously a 400 metre runner, national champion, obviously tend to load these hamstrings up a fair bit, don't you?
Yeah.
What do they feel like at that last 100, Tess?
100 needles?
100 needles. So we talk about 100 needles. So obviously this type of technique is always going to be really, really great. Approaching the upper part of the hamstring, and this is sometimes where we feel most of the restriction. So once again, you'll notice it's just a slow process. We're not trying to work deep or hard, because that's counterproductive. Sometimes you'll find your clients will just push you out, and that's not ideal. Okay, so take the time to engage that tissue, work all the way through it, be purposeful, and then you'll see the changes that you need. So, you know, 1 or 2, 3 sweeps, depending on how well you engage that tissue. You can modify if you want to go a little bit more medial, or you want to come out lateral and hit that biceps femur, or you just want to stay within that semi-tendon, semi-membranosus sort of fascia. Okay, really quite simple technique. Make sure that there's no pain in that hip flexion before you start, so make sure you test it. And then at the end of the range, end of the day, after you've done the technique, obviously take it back up and then reassess again. Okay, simple process, end of range hamstring